For Action News, this is your health news update. About 3 million women in the U.S. will have an unclear or abnormal Pap test each year, which may be followed by surgical procedures. And according to the CDC, these procedures to diagnose or treat any precancerous lesions do not affect fertility. Researchers looked at records from more than 4,000 women who had a cervical procedure. They were then monitored for 12 years until they became pregnant. The study found the fear that these types of procedures could weaken the cervix and reduce fertility was false. The results are comforting, and they also bring up the opportunity to remind that vaccines against HPV, the leading cause of cervical cancer, are very important. Speaking of vaccines, the CDC also recommends that children be vaccinated for 14 diseases before the age of 6. That's a total of 29 shots, and sometimes several of them given at once. The schedule is designed to protect infants and children early in life. Yet many parents needlessly worry about the vaccines. Worse yet, the New York Times says doctors reluctantly give in. A survey published in Pediatrics says 93% of doctors reported they've been asked by parents to spread out vaccines. And an astounding 80% of doctors cave and agree to spread out the vaccines. The New York Times quotes Dr. Paul Offit, who says too many doctors comply, making them part of the problem. Finally, the New York Times' recent editorial on narcotic abuse strikes a nerve with ACTIA's Dr. Josh Bloom. He says their solution to the serious problem could be worse than the problem itself. The editorial suggests that long-term opioid use does not treat chronic pain, especially in high-risk patients. Thus, many are over-treated, and many turn to painkiller addiction. Though this may be true, the problem won't go away with stricter regulation. A perfect example is OxyContin. You can find out why on our website at action.org.